As we grow older, our bodies change in ways that are sometimes subtle, but other times unmistakably loud. One of those loud, painful signals? A sudden muscle cramp in the middle of the night. It's not just a nuisance. For many older adults, it's a recurring issue that affects sleep, mobility, and overall quality of life. Muscle cramps can happen to anyone, at any age. But if you're over 60, chances are you've felt that sharp, tight squeeze in your calf or foot more often than when you were younger. Why does this happen? And more importantly, how should seniors manage and respond to these cramps differently? Let's explore how aging affects muscles, what makes cramps more common in the elderly, and what specific actions you or your loved ones can take to reduce their frequency and severity. First, we need to understand what aging does to our muscles and nervous system. As we age, we naturally lose muscle mass, a process called sarcopenia. This loss begins as early as our 30s, but it accelerates around the age of 60 and beyond. Less muscle mass means less fluid balance in the muscle tissue, and often reduced flexibility. Both of these factors increase the likelihood of muscle cramping. But it's not just the muscles themselves. The nerves that control our muscles also become less efficient with age. They might send signals more slowly or with less coordination, which can lead to involuntary contractions, what we know as cramps. These age-related changes aren't due to disease, they're simply part of the normal aging process. So how are cramps in seniors different from those in younger adults? For one, they tend to occur more frequently during rest, especially at night. You may have heard the term nocturnal leg cramps. These are especially common in older adults. Unlike cramps caused by intense activity or dehydration in younger people, older adults often experience cramps even without clear triggers. This makes them more frustrating and harder to predict. Another difference lies in recovery. Younger people may bounce back from a cramp in a few minutes, but for seniors, lingering soreness or reduced mobility might persist for hours or even days, especially if the cramp was severe. This can discourage movement and lead to a dangerous cycle of inactivity, muscle stiffness, and more cramps. There are also lifestyle factors that play a bigger role in older age. Many seniors take medications like diuretics for high blood pressure that can deplete important minerals such as potassium and magnesium. These minerals are crucial for proper muscle function, and a shortage can make cramps worse. Hydration also becomes more of a challenge with age. Older adults may have a reduced sense of thirst, leading to chronic low-grade dehydration, and with less water in the body overall, muscles are more prone to involuntary spasms. So what can older adults do differently? First, keep a regular hydration schedule. Don't wait until you feel thirsty. Drink small amounts consistently throughout the day. Adding a pinch of natural sea salt or drinking an electrolyte-rich beverage can also help maintain mineral balance, especially in hot weather or after light activity. Second, stretching is crucial. Gentle daily stretches, especially before bed, can reduce the frequency of nighttime cramps. Focus on the calves, hamstrings, and feet. Don't overdo it. This isn't about intensity, it's about consistency. Third, review your medications with your doctor. Some prescriptions may be contributing to your cramps. Don't stop taking anything on your own, but bring it up during your next checkup. Now, when should a senior seek medical attention for muscle cramps? Most cramps are harmless, though painful. But if they become very frequent, say several times per week, or are accompanied by other symptoms like swelling, numbness, weakness, or color changes in the legs, it's time to talk to a doctor. Sometimes what feels like a cramp could actually be a sign of a circulation problem or a nerve disorder, especially in older adults with diabetes or vascular conditions. Also, if cramps wake you up nightly or cause you to avoid walking, you might be limiting your independence without realizing it. That's why it's so important to bring it up with a health care provider, even if it seems minor. the goal isn't just to stop the cramp. It's to maintain mobility, confidence, and a good night's sleep. Let me share a real example. Mr. Hen, a 72-year-old retired teacher, experienced calf cramps almost every night. He drank enough water, or so he thought, and he was reasonably active. But after a conversation with his doctor, he discovered that his blood pressure medication was lowering his potassium levels. Once adjusted, and with the addition of a simple nightly stretching routine, his cramps nearly disappeared. His sleep improved, and so did his energy during the day. Pacha. Stories like his aren't uncommon. The solution doesn't always require complex treatment. Often it's about small, consistent changes that respect the way an older body works. Let's recap the key points. Aging causes muscle and nerve changes that increase cramp risk. Seniors are more likely to experience cramps during rest, especially at night. Medication side effects and dehydration are common hidden culprits. Gentle daily stretching and mineral support can make a big difference. Don't ignore cramps that are frequent, severe, or come with other symptoms. Check with your doctor. Living well into older age doesn't mean living with constant discomfort. With awareness and a few simple habits, older adults can reduce the impact of cramps and keep moving confidently. Thank you for watching this episode. If you found it helpful, please consider liking this video and subscribing to the channel for more health tips tailored to older adults and those caring for them. In the next episode, we'll dive into long-term prevention, daily habits, diet, and simple tools that make life cramp-free and more comfortable. This video is for educational purposes only and does not replace professional medical advice. Always consult a healthcare provider for personalized guidance.